Hello and welcome. I'm Rommy Castaneda. Thank you so much for joining me for today's presentation because I get to introduce you to a new herb that can be used in the treatment of Candida overgrowth and infection. Let me tell you a little bit about why I'm here today and what I'm going to talk to you about and why I hope the information that I'm presenting can be of value to you. I am part of the evidence sciences team of health professionals and research clinicians, and we are a group of clinical nutritionists and naturopaths who, under the guidance of Dr. Beth Steels, will focus on providing specialized research to support health practitioners and their patients. What's probably more relevant to you is that I'm a practicing research clinician, and what that basically means is that I am actively working in clinical practice and also complement this as a professional researcher at evidence sciences to support the discovery and the development of new treatments that we can use with our patients. And I'm also involved in developing educational materials to further our industry knowledge, which is all part of what I'm doing here today with this presentation. And then this next hour or so, I'm going to tell you a little bit about Horopito and some of the research that's been done with this herb in relation to women's health. What I'm here to talk to you about today is at two levels. One is sort of a high level, so a little bit technical perhaps, but this is going to help me shape the context. So in other words, it will help me give you some context by explaining some of the complexities of Candida into some detail as a health condition. So what it is and how it can affect women's health. And on a more simpler level, I will be giving you some information and some insights into this new treatment and how it can actually be used. So you're going to learn about Horopito as a new way to treat Candida infections. We'll also look at the symptoms that are common in Candida infections to give you a better understanding of what's happening during an infection and what to look out for. So I'm going to talk to you about some very specific things, and I'm going to spend the time on this. So by the time you finish this presentation, you will have a better understanding about Horopito and its use in vaginal health. Now, before we talk in detail about Horopito, I want to spend a moment on Candida here. Now, Candida is a species that is part of our natural human microbiota. It is a yeast that lives in the human body and is one of the many different kingdoms that make up our digestive microbiome. It inhabits different environments in our body. It's in the digestive tract, so the oral cavity, for example, it's in the gut and in the intestines. It's also found on the skin and the lower reproductive area, so the vagina and the genital environments. Now, under normal conditions, Candida is kept in balance by our immune system and other organisms in the body as well. But if a person is compromised and then there is a disruption to that normal balance of Candida, then it starts to overgrow and turns into a pathogen that is capable of producing infection and disease. Now, Candida infections are quickly becoming one of the most prevalent conditions that affect men and women globally. Infections have a wide range of impacts that we're still, after many decades of research, only really beginning to understand. And some of these impacts will range well beyond the commonly known thrush and digestive symptoms and have the potential to create some very serious health complications. So as we look for new and emerging treatments that can be used in the treatment of Candida infection, we have found Horopito, which has emerged as a novel therapy for us to use. It is a fascinating ancient herb, and it has a long tradition of use in treating a range of health conditions. It is a unique herb, and in many ways that provides us with a further option that we can use in our treatments. From a research perspective, it has some really interesting therapeutic activities. It has shown to reduce the growth of Candida species. It's also shown to have more of an enduring effect in preventing relapses of thrush and infection. So what I really want to do today is to give you a little bit of information about how it works and look at what combinations we could possibly use it with. So far, we have tested this herb in a small pilot study, and I'm going to talk about that shortly, and we're going to look at the results of some of those case studies that we did. So to start off with, let's have an overview of the herb. So what's new in the treatment world? We have Pseudowintera colorata. Now, this species belongs to a species that evolved mostly in the southern hemisphere. Now, it's quite an ancient herb and one that has been used or has been part of the traditional use of medicinal practices of many cultures. Now, it's commonly known as Horopito. It's endemic to New Zealand. It's also known as the New Zealand pepperwood because it has this very hot peppery flavour in the leaves, traditionally used by the indigenous Maori peoples of New Zealand. Now, if we look at the way in which Horopito works, we find that it contains an active constituent called polygodiol. Now, this constituent has the ability to confer this antimycotic activity, so it gives an antifungal activity. Now, there's been some very early research on Horopito that shows that the polygodiol is able to inhibit and suppress the growth of Candida colonies. And what this research suggests is that this polygodiol constituent that is found in Horopito works as a fungicidal agent on yeasts. And all that means is that as a fungicidal agent, it kills pathogens. Now, interestingly, what we found with Horopito is that it works best in acidic environments, which makes it really relevant for treatment, as we're going to see shortly. In summary, polygodiol is considered to be an anti-candida agent. And I'm going to show you now some of those clinical studies that we have been analyzing, where Horopito has been used in treatment of candida infections, particularly vaginal thrush in women. Now, this first study examined Horopito compared to a particular azole drug in women who had recurring episodes of vaginal thrush. Now, there are 4 major classes of antimycotic agents, of which the azoles are the most commonly used and generally the initial preferred treatment when somebody has a vaginal thrush infection. Now, this study took place over 12 months. As you can see here, the 2 groups of women were randomized or selected into an azole treatment group and a Horopito extract treatment group. And what the researchers were looking for was how comparable the effects of these 2 treatments were on the symptoms that are listed here. These are the symptoms that they screened for and that are associated with vaginal thrush. What they found was that though the azole group initially reported some very early symptom relief, over time, however, their symptomology scores compared to the Horopito group were not all that different. In fact, both groups showed that they had a comparable benefit in providing symptomatic relief. This is a visual representation of that previous slide. As you can see, the azole group on the very top line had that very early symptom relief. This was a period of 6 months that they were given this treatment. However, the Horopito group over time also managed to provide a comparable benefit for symptomatic relief. Now, the benefits of Horopito really became apparent during the observational period, was 6 months after the treatment. The fungal eradication rate, so the ability for both treatments to eradicate the infection, was actually comparable between the 2 groups. However, the Horopito group showed lower relapse incidences compared to the women who were in the azole group. And also, women in the Horopito group showed that they were able to sustain this therapeutic effect for a lot longer across the whole duration of the study by comparison to the women in the azole group. As you can see here, this is a representation of the fungal eradication rate and the therapeutic rate as well. So in the azole group, they started off very strong in the beginning, but over time, if you can see that white bar, it actually decreased. Whereas the Horopito group was able to sustain their effects steadier right throughout the study period. Now, this is the second study that was done on a larger group of women. Again, they were randomized into 2 different groups, and this study took a period of 2 years, again, on women with a history of recurrent thrush. Now, in this study in particular, the relapse rate, again, was lower in the Horopito group by comparison. And what the researchers found was that Horopito has more of a beneficial prophylactic effect, so more of a preventative effect. Now, the eradication rate, or the fungal eradication rate, was similar for both groups. However, over time, women in the azole group started to show a resistance to that antimycotic therapy. And they also started to show also different candida species began to show up in these women as well. Now, this is a representation of the relapse rate over 2 years. And as you can see, the azole group, which is the white bars, had a higher relapse incident rate compared to the Horopito group, which is in the red bars. So when we look at these clinical studies, we see that Horopito was effective not only as a treatment, because it managed that to reduce that the fungal eradication rate was stronger, but also as a maintenance and a preventative therapy, was also able to reduce antimycotic drug resistance. And over time, if you think this was a 2-year study, over time it showed a lot better tolerance compared to the azole group. In terms of contraindications and precautions, when we're looking at the literature, we don't have as yet a data safety profile on Horopito. So what we would recommend and what we suggest is that pregnant and lactating women should avoid it. There has been one case study report that showed that there was a contact vulvitis in using a vaginal application of a cream preparation that contained Horopito. In terms of interactions, we don't have information on that as yet. Now we're going to look at some case studies. As part of our research, what we wanted to do was not only look into what the literature and the clinical studies were saying about Horopito as a treatment for Candida overgrowth, but we also wanted to validate these effects for ourselves. So what we did is we did a case study analysis to assess the effects of Horopito on actual clinical patients, and we were tracking any changes that were occurring in time. Now, this was a small clinical pilot, so we invited 12 patients who had a history of either gastrointestinal symptoms and/or genital thrush to participate in what ended up being a 4-week open-label study. And what we wanted to get out of this study was to test Horopito as an anti-Candida agent on our patients, and also we wanted to gain information from our patients into their experiences with thrush and the treatments that they have been using historically as well. Now, our participants were screened initially to ensure that they actually met the criteria so they could participate in this pilot study. And once they were actually recruited into the study, we conducted interviews at 1-week intervals. So at the end of 7 days, we would reassess their symptomology. Now, I'm going to provide you with a summary of this pilot study and the findings first, and I've also pulled out a mix of case studies to share with you as well. So as you can see, we had 9 female participants and 3 male participants in this study, and there is a reason for that, which I'm going to explain that in a little while. Now, when we initially screened our patients, we actually screened them for these symptoms that you can see listed on this slide, which in the literature are symptoms that are commonly associated with Candida overgrowth. Now, as you can see, patients were given a Horopito preparation once a day with meals for a period of 4 weeks. And this is a summary of the results. We had 10 out of 12 patients who reported some improvements in general. We had 2 patients who had no improvements or changes to their initial symptomology. The most significant improvements first up and very early on were related to digestive and nervous system. In particular, we noted a fast initial reduction in brain fog, as was reported by some of our case studies. Now, we can't identify the actual mechanism for that through our work so far, but that is an area of research that we are still undertaking and looking into. So the improvements were noted for the digestive symptoms, as I said, so gastric pain and cramping and reduced discomfort after eating. They were very early symptomatic relief. We also had nervous system relief, so we had improvements in memory, reduction of brain fog, improvements in energy levels and sleep quality. We also had improvements to the immune system, so we're looking at a decrease in things like itchy skin and dermatitis, flare-ups, also post-nasal drip, and just a general reduction in that general malaise. Now, we're looking at the thrush symptomology. We noted improvements for things like discharge, irritation, and discomfort, so all those thrush symptoms. In particular, what we recorded was a very notable reduction in the number of episodes of thrush that patients were experiencing while they were on this treatment, the severity of their symptoms, and also the duration of thrush episodes that were occurring during this treatment period. Now, none of our patients reported any adverse events or side effects, and over 50% of our patients voluntarily chose to continue using Horopito after the study had finished. Now, you may have noticed that we also included men in this study, and we did that for a particular reason. And the reason is very simple. Candida is not selective. Candida is a natural part of the human body, and when it overgrows, it can affect anybody at any point in their lives. And it presents in different ways in different individuals. So when it comes to Candida infection, you can have gastrointestinal symptoms, you can have genital symptoms, you can have general immune systems, and a great variety of symptoms when it comes to this infection. And what we've discovered is that men get thrush too. Now, there are particular circumstances under which this can happen, and I've highlighted that in one of our case studies. So we're going to look at some of those case studies in a little bit more detail now as well. So to start off, we have a 48-year-old female, and the reason why this case study is in this presentation is because here we have a chronic case of vaginal thrush that is triggered by stress and antibiotics. And I'm talking chronic case because this patient in particular experiences vaginal thrush on or off for about 10 years or so. And so one of the major triggers for this patient are things like stress and the antibiotics, to the point where she avoids antibiotics because they will, according to her, immediately trigger an episode within maybe hours to 1 day. She'll start with the symptoms of vaginal thrush. Also, she had some digestive presentation as well. So we're looking at things like indigestion, bloating, those irritable bowel symptom type symptomology. Generally poor fatigue and nervous system, the brain fog, anxiety, poor concentration. This person also had some immune involvement and then the genital involvement of the thrush symptoms themselves. So irritation, urination frequency, and so on. Now, during the treatment and post-treatment, what we recorded was a significant decrease in the gastrointestinal symptomology. So decreased bloating, flatulence, stomach gurgling, some very notable clearing effects on brain fog and energy. This person also had immune system involvement, and what this person noticed is that there was a decrease in that post-nasal drip, so that immune involvement. Now, this particular patient was actually taking a daily oral antihistamine and also using some nasal sprays. And she found that throughout the 4-week treatment, she was able to significantly either stop them or reduce them. No thrush episodes occurred during this period. Now, this patient, during this 4-week study, went through some very stressful personal circumstances, which she noted to us that in the past would have been enough to trigger thrush episodes. However, during this 4-week period where she was on this Horopito treatment, she had no thrush episodes regardless of the stress that she was experiencing, and reported no side effects. She chose to continue using Horopito post-study as well. This male is 47 years old. Now we have a male here, and the reason we have this male here is, again, we have a chronic case of gastrointestinal Candida overgrowth, more or less over 10 years. And again, one of the triggers for this patient was stress. And the gastric symptomology would fluctuate severely with the level of stress that this person is experiencing. Now, this person's mainly experienced IBS type symptoms, and we're going to talk about IBS further along because IBS is actually also attributed to Candida overgrowth. Some stomach distension, indigestion, generally had some fatigue, muscle aches, and severe sugar cravings that were generally triggered by anxiety and stress. As a result of those sugar cravings and that stress, this person broke out in hives, so they had immune compromisation and also some nervous system involvement as well. What we recorded post-treatment for this patient was that his improvements showed up more in the 2nd and 3rd weeks of treatment, and particularly that gut distension was severely reduced. Now, this patient was quite interesting because if they ate something that would trigger or feed that Candida infection, their distension was quite severe, to the point where the abdominal skin actually became quite shiny and quite tense and very, very heavy. He found that the gut symptomology calmed down quite a bit. He had decreased levels of fatigue and stress. He was going through some stressful circumstances during this 4-week period as well, but he found that his response to stress wasn't as severe, so it didn't trigger things like the hives or the sugar cravings. He found that he had some improvement, but because he believes that he is more of a chronic case, he chose to continue using the Horopito treatment post the study, just so he can maximize the benefits of that treatment. And again, no side effects for this patient. Now, this is a very interesting one that I really wanted to highlight about when I talk about men of getting thrush as well. Now, there are particular circumstances in which that can happen, and this is one of those. This male is a 36-year-old male who has type 1 diabetes, and his episodes of thrush are associated with high blood glucose readings. No GIT symptomology that was noted at the time, some general symptomology like fatigue and poor sleep patterns. This person, being a diabetic, had removed or reduced all alcohol and followed a very disciplined eating structure or a diet, so low sugar diet, making sure that he wasn't exacerbating that thrush. After 4 weeks, this patient noted that their thrush episodes were less severe and less duration. It didn't prevent them from occurring, but the severity of the symptomology and the duration of the episodes were a lot less. And this patient, again, would continue using Horopito because they saw a future potential benefit in using something that, again, didn't provide any side effects or didn't interfere with anything else. Here we have a case of recurring vaginal candidiasis, sporadic or spontaneous. This is a female who's 27 years old, very active lifestyle, very fit lifestyle. She is on the oral contraceptive pill, and there is a relationship between hormones and vaginal candidiasis as well. Some anxiety issues. Her anxiety issues were mostly triggered because she was having vaginal thrush. She had these recurring episodes. We were looking at what triggers could possibly be there, and she was suggesting perhaps something to do with dehydration, high levels of training. But whatever the trigger was, it was severely impacting her quality of life. And this was then leading into some comorbidities where it was affecting her mental health. Okay, being quite fit and quite disciplined, she followed a very low sugar diet. So she was very disciplined in her diet. So this is where we come in when we're starting to look at what else could be happening in this person's life or in this person's system and body that could be triggering these symptomologies, these episodes of vaginal thrush. So what we recorded post-treatment with this person is that she actually had less episodes during that 4-week period. More importantly, her anxiety levels were also better managed because she felt less stressed about getting the infection. She now had a recourse of treatment that she could possibly use long-term with minimal or no adverse side effects. And she recorded no side effects during those 4 weeks. Now, she didn't get them stop getting them completely, but they were reduced in terms of the frequency and the severity. Now, as I mentioned earlier, vaginal thrush or vaginal candidiasis infections are some of the most prevalent infections worldwide. Much of my research on Horopito is focused on the effects of Horopito on the vaginal area, but just how prevalent is something like vaginal candidiasis? How much of an impact is it actually having on people's lives? And more importantly, how are people managing it? What are they using, particularly from a patient's perspective? Now, these are some of the questions that I'm still asking, and we're still asking ourselves as we delve deeper into the research. To help us better understand some of these questions, especially from a patient's perspective, earlier this year, there was an online survey that was conducted on about 819 Australian women who have experienced vaginal thrush. Now, you can see some of the survey results on this slide, and I'm going to quickly just sort of mention and highlight some of that. So what we found is that of the respondents, about 65% of women experienced vaginal thrush in the last 5 years. So I mentioned earlier that vaginal thrush is not uncommon. But what we're looking for is women who are experiencing those 2, 3, 4 or more episodes of thrush per year, so in a 12-month period. That's when it becomes recurrent vaginal candidiasis. And as you can see on this slide, some of the respondents are actually falling into that category. Now, we have a response here. About 45% of women reported negative impacts on quality of life, QOL, particularly in that younger women category who felt the effects more severely. So when the quality of life is impacted, we need to also take that into consideration as practitioners. What else is affected in their life, and what other things might be then contributing further to more episodes of thrush reoccurring? Now, what we found also was that when we asked these women, what was the cause? What did they think or believe that the cause of vaginal thrush? Most of them responded that it was in response to antibiotics and medications. So what we found is that only about 16% of the respondents knew that there was a candida or some form of yeast was the primary cause of vaginal thrush, of that thrush imbalance, which means that about 84% of the women who responded did not know the link between candida and vaginal thrush. So for us, the understanding that candida overgrowth is the primary cause of vaginal thrush is quite poor amongst the population. Now, in terms of symptoms, vaginal itching was reported as having the most impact on quality of life. Now, what's interesting for us is that there is a percentage of women who don't feel comfortable talking to a GP about vaginal thrush and the symptomology and the quality of life impacts. And this is where we as practitioners can play that really pivotal role and supportive role. Now, those, after giving a lot of our respondents information on Horopito and the mechanisms of action, we showed them some of the studies. About 45% of these respondents were quite positive to trying Horopito because they saw a benefit in using a natural product that could be used long term. And a lot of these respondents had already used other treatments that they found weren't as effective over the long run as something like Horopito was showing to be. Now, this is a very small survey and it's quite localized. It gives us an insight into the prevalence of thrush, what people understand about the condition and how they are currently managing it. But when we search for larger data, so for larger pieces of information, we know that on a global scale, it affects millions of women. And I'm going to show you this very briefly now. Now, this is a snapshot of the global distribution of vaginal candidiasis. Now, the estimates for the number of thrush infections, they come from different sources, and where they are reported and if they are reported, they're generally very crude estimates. This global snapshot captured a female population within the years of about 15 to 54 years of age, which is generally termed as those reproductive years. This comes from a 2013 surveillance that was then published in 2018. And what this study actually finds and concludes is that they estimate that approximately 138 million women around the world are affected by recurrent vaginal candidiasis each year. And the highest prevalence of these recurring thrush episodes happens in women that are aged between 25 and 34 years of age. Now, what this study also predicted was that by the year 2030, the population of women who will have recurrent vaginal candidiasis, remember that's 2, 3, 4 episodes or more each year, will rise to approximately 158 million. So what does this mean? It just means that it's not uncommon. And in terms of how many women get it, the literature says that about 75% of women will experience an episode of vaginal candidiasis at some stage in their lives. And that approximately about 5 to 6% will experience those recurrent episodes. So they'll fall into that recurrent vaginal candidiasis subgroup. And all that means is that they are experiencing 4 or more episodes of vaginal thrush in a 12-month period. What about Australia when it comes to Australia? Well, there's been a very, very small report, abstract, that was published in 2018 that kind of alluded to the prevalence of vaginal candidiasis in Australia. And it mentioned a figure around the 559,000 women a year will experience recurrent vaginal thrush, which translates to about 6,200 women out of every 100,000 each year. If we look at the estimates for New Zealand, we have a total burden of vaginal thrush of about 60,000 women a year, which is about 2,700 women out of every 100,000 women. So what are we actually talking about? Well, we're going to look at Candida a little closer now. And if we look at some of the symptoms, these are some common symptoms that often are associated with Candida infections and episodes of vaginal thrush. So if we look at Candida more closely, what is Candida and what role does it actually play in vaginal thrush? Well, as I mentioned earlier in this presentation, Candida is a yeast and it is a natural part of the normal flora of our bodies, and it resides mainly in the digestive tract, but it also naturally present in the vagina and the skin. It's just one of those many microorganisms that naturally exist in the human gut. Now, research does show that it is needed for digestive processes and potentially for some really intricate immune function as well. And though it's a normal yeast that's found in the body, the problem actually arises when it starts to overgrow and develops into thrush that affects the membranes of the mouth, the gut, and the vagina and the genitals. Now, because Candida is kept in check by the immune system, if an individual is compromised, it will actually take the opportunity and start growing. And this is where different symptoms can actually develop. So why is Candida such an issue? Well, because it can cause an extensive range of infections, and these can be either localized infections, say, for example, those affecting the mouth or the skin, and they can be superficial and broader, so they can affect a wider area of the skin, for example, or the nails, or they can become even more systematic, and they can affect other sites, such as the vagina and the digestive systems, and possibly other areas of the body as well. So what happens when it becomes a disease? Well, in the next few slides, I'm going to show you for you to see what a Candida infection actually is. But first of all, we're going to look at SIFO as a new term that is emerging. Now, a lot of you may be familiar with the term SIBO, which is small intestinal bacterial overgrowth. Now we also have SIFO as a term referring to small intestinal fungal overgrowth. And it basically refers to to excess fungal growth in the small bowel that is attributed to a Candida species. Now, SIFO has been associated with IBS type symptoms, and they include those like flatulence and bloating and so on. And its clinical presentation can often be hard to differentiate from SIBO. And what happens is that often patients will present with a mix of SIBO and SIFO, which then presents challenges to diagnosis and treatment. So really understanding how Candida works and what it's doing is going to be crucial in order to help us best target our treatments. In the next few slides, I'm going to briefly highlight some of those key factors and those contributing factors that can disrupt the natural balance of Candida. But I'm going to show you this first, which is, with my intention, it's the infection pathway of Candida, what happens here when it overgrows. Now, this is a visual representation of the pathway infection, and I'm going to briefly discuss these 4 points, this 4-point process in the next few slides as well. So the first point in that pathogenesis pathway is a compromised host. So if a host is compromised, then there are many things that can disrupt the normal balance of Candida in the body, including things like lifestyle factors and medications and immune disorders and other inflammatory conditions. So all of these factors that you can see listed here in the next slide can influence the amount or the type of stimulation that the immune system receives, and therefore that will affect inflammation. Now, I'm going to just briefly talk about something simple here, like nutrition. How does nutrition play a role, or how it might play a role? Well, we know that high carbohydrate diets, primarily those that are in the simple, processed and refined carbohydrate group, they are correlated with high Candida levels in the gut. So if an individual is generally consuming a range of simple sugars as part of their regular dietary intake and habit, and they are in some way compromised, say, for example, they might be on antibiotics, or they're experiencing periods of ongoing or chronic stress, or there might be something else happening in their lives, and their immune system is not going to be therefore as strong as it could be in order to control that Candida overgrowth. And what Candida does then, it uses these carbohydrates that are entering through this diet as a primary source of energy, because they provide a sugar component that Candida needs in order to strengthen its own cellular structure and survival. So dietary intake does play a crucial part in ensuring that we are not feeding an infection if our immune system and our defenses are not optimal. Now, another key factor that I want to highlight is the disturbance to the natural balance of the microbiome. So the protective bacteria in the gut and those colonies in the gut that are supposed to keep everything in balance. Now, the protective bacteria in the gut, which is the lactobacillus, is what keeps Candida under control in healthy people. If that beneficial bacteria is disrupted, it's destroyed, or it's out of balance, then there isn't sufficient levels or quantities of lactobacillus to support our immune system and control Candida. As a result, Candida will start to overgrow, it will start to proliferate and disperse and become infective. Now, this is why any disruption to that beneficial lactobacilli colonies, say from antibiotic use, for example, promotes Candida proliferation, and why some women who take antibiotics will end up with episodes of vaginal thrush. So what makes Candida such an infective pathogen? Well, the second step in Candida infection is the adhesion. And when we look at Candida a lot more closely, it is primarily made of some really intricate carbohydrate and protein structures. So the organism itself is made up of a complex carbohydrate and protein structure. And when the normal balance of Candida is disrupted and it starts to overgrow and become infected, these structures that make up Candida as an organism will help it to adapt, will help it to survive, will help it to adhere to mucosal surfaces such as the vaginal lumen, for example. Now, this is an image of Candida as a shapeshifter. What we've discovered in the research is that Candida can actually shapeshift into different forms. And it does this to ensure that it can continue surviving and thriving and infecting. And as you can see, it goes from a bud to a long branching filament, and it produces more buds from that. And as it starts to overgrow and become more infective and invasive. Now, because Candida is made up of these carbohydrates and proteins, it can actually utilize that structure to create what we call a slimy biofilm. And what a biofilm is, it's a cluster of Candida cells that create a real invasive colony. As I'm going to show you this in the next image as well. And the result of that is that these biofilms will start to grow and they multiply and they produce more cells, and they actually then create what we call a Candida storm or a Candida load that then leads to the development of symptoms. Now, this is a mature Candida albicans biofilm. And as you can see, it's actually got the filaments and the buds, and this will continue to proliferate, multiply, grow, and adhere to these different mucosal surfaces. And what we found in the literature and the science is that biofilms are actually extremely difficult to eradicate, and they actually make a patient less susceptible to fungal treatment. So they make a person more resistant to treatments and to those sort of generalized antimycotic treatments. So as the Candida storm or this Candida load starts to trigger inflammation, it starts to recruit inflammatory cells. And this actually leads then to the development of these symptoms. Now, as we know, the disruption to the normal yeast levels in the gut or in the body can occur from a range of things. And I showed you some of those contributing or disruptive factors in the first few points. And when Candida overgrows, the yeast cells are then absorbed into the body along with its toxins. And so as Candida starts its colonization and invasion, one or all of these symptom categories that you can see here can develop. And often the type and the severity of symptoms will depend on the location of that infection. Now, a lot of my research is specializing on Candida overgrowth in women's health and the use of natural herbal compounds like Horopito. So let's look at the vaginal microbiome in a little bit more detail to give you a little bit more information on what happens in that environment. Now, the vaginal microbiota, that refers to the community of fungal microorganisms that populate that lower female reproductive tract. It is a complex area of study, and we're only really starting to really appreciate and understand the impact that these species can have in women's health. The totality of the microbiome organisms that are present in the vagina, we don't actually know that. And that's an area of research that we are still undertaking and investigating. But what we do know is that the lactobacilli that dominate the vaginal microbiota is actually believed to have derived from the gut. And what we also know is that the gut and the genital tract microbiota, so the microbiota that is found in those two environments, are in continuous communication with each other and both interact and influence the immune system. So what is vaginal thrush more specifically? It is the presence and signs and symptoms of inflammation that are caused by a Candida species in the absence of other infective pathogens. That's a very simplified version or description or definition of vaginal thrush. And the literature gives us two classifications. That gives us the uncomplicated and the complicated. Now, in the complicated classification, the interesting thing here to highlight is that vaginal thrush can not only be caused by Candida albicans, but other Candida species can be involved as well. These are some of the very typical clinical symptoms that can be present during thrush infections. Now, there are a broad range of factors that can disrupt the natural balance of that vaginal microbiota. However, we've also found that sometimes there may not be a clear and distinct or even a severe predisposing factor that makes someone more susceptible to vaginal thrush, because healthy women can also develop vaginal thrush quite sporadically as well. However, what we do understand is that there is still a level of disruption of that vaginal environment that promotes the development of vaginal thrush, that there is some reason that this disruption is happening, it's occurring, and often the root cause of that may not be immediately evident. And this is where we as natural therapists will use all of our education and training we employ this approach that is intended to rebalance things. And what we do is we take all of this information to help us devise a treatment program that takes into account all of the presenting symptoms, the signs, the underlying factors that might be contributing to Candida overgrowth. And that also includes assessing other body systems as well to provide an integrated approach to treatment. What we are trying to do is to bring things back into equilibrium, such as the immune system, for example, and to create the circumstances to put Candida back in the place where it should be. So what we look at is how might each other system in the body be interacting and affecting another, and potentially creating the environment for the development and the proliferation of certain conditions. And so we by establishing this, we can also then determine the types of treatments that our patients may require. So keeping in mind that the particular presentation of our patients might actually require or necessitate a range of different therapies and a range of different compounds to provide a broader approach to rebalancing and that restoration of health. Now, as I mentioned earlier, Candida goes through a range of stages to promote infection, and I talked about these 4 points just a little while ago. If someone's defenses are compromised in some way, it will actually start to grow. It'll shapeshift, it'll adhere to vaginal surfaces and potentially create biofilms, and this all leads to this Candida load and the onset of those symptoms. So what I'm showing you here is where different compounds can be used and where they may be applied. Now, this is not comprehensive, it's just a guideline. And as you can see here, Horopito may potentially have a role to play right throughout this process. Now, based on the 2 clinical studies I discussed and the case studies, Horopito is a promising new treatment for Candida and vaginal thrush. It is exciting to see where this research is going, but we do need a lot more research to fully understand Horopito and Candida. To give you an example of rebalancing the body, when using a Horopito with something like probiotics, for example, we would be aiming to obtain a dual treatment effect. So what I'm referring to is that on one hand, we want to rebalance and restore that microflora, which we'll get from the probiotics. And on the other hand, we want to eradicate that Candida overgrowth, which is what we'll get from Horopito. To ensure that we are getting the most from each treatment, we could possibly think about dosing these 2 compounds separately from one another. And one way to do this could be perhaps giving the probiotics in the morning as that rebalancer and the Horopito in the evening as that eradicator. And that way we can ensure that there's no interactions, so we can maximize the benefits from both treatments. So in this presentation, I've covered some of the very early research into Horopito as a new way to treat Candida overgrowth. And I've also briefly discussed some of those complexities of Candida as far as we know to date. We have seen how Horopito can be used as a new treatment for Candida overgrowth and thrush, and so it becomes a new addition to our suite of treatment options. It's showing some really exciting potential for Candida infection prevention and treatment. I'd like to thank you for joining me today. I have come to the end of my presentation, and I hope that you have found this information valuable. As my research in this area progresses, I look forward to being able to share that information with you in the near future. Thank you so much.